It was set up by MSF Spain. We are doing partnership with them. And then they also trained me as a counselor. And then I test people every day. And then here I'm just waiting for their results. And then we have been receiving overwhelming response. And in a weekly basis, we test about 15, 20 people. So it's really good. As in to see the community members coming out in such large numbers. As in monthly basis, we report about 70, 80, so it's really a challenge.
We have a number of activities that take place here. Other than just providing HIV/AIDS information through various education materials, we also offer VCT, or voluntary counseling and testing, peer counseling. We also have what we call community youth gatherings. These gatherings are conducted to youths living in surrounding communities, and they conduct regular lessons on HIV/AIDS and life skills to these youths. And then apart from that, we also have educational tours. These educational tours are basically for the rural youths. And these educational tours see these youths, they take these youths to town to visit our different partners and government departments and to learn more about HIV/AIDS and other HIV/AIDS services by these partner organizations and government departments. We also have what we call the referral system at the same center. Our volunteers do referrals for cases that they cannot handle. They refer these clients to specialist providers. These are health centers surrounding the communities and other organizations offering different services in town. So all these activities are done as part of our efforts to increase knowledge and awareness on HIV and AIDS.
The Community HIV and AIDS Intervention Program is a comprehensive community program that reaches everyone where the program operates. The volunteers working on this program also conduct door-to-door campaigns. One of the biggest events on the volunteer calendar at the Youth Center is the Health Day. The Health Day is a big event for volunteers because on this day, partner organizations join CYM in rural areas to take their services near to rural community residents.
Okay, here we are again in the counseling room, and we'd like to take advantage of the fact that I think the counseling room and testing room is free. So just join me and let's meet the gentleman that is in there. Yeah. Good afternoon, sir.
Good afternoon.
How are you? I'm fine. So probably if you tell us your name and what you're doing here.
Okay. I'm Hastings Lupapulo. I'm a lab technician working for Kara Counseling. We are here basically to carry out mobile VCT in Kasavasa, organized by Community Youth Mobilization, CYM, our partners. They are calling it a health day, and we are here to participate in the health day itself by providing services. It's VCT and more sensitization on HIV and AIDS. Basically, we've had a good turnout. We've seen a number of clients. It's been a good day, so to say, on our side, and we appreciate CYM for bringing us along on such ventures to be able to provide a service to the people in the communities where the service is not so much available.
I'm Nelly Mumba from the Education Department of Drug Enforcement Commission, which is known as the National Education Campaign Division. We've been working with community youth mobilization in sensitizing people on the effects of alcohol and drug abuse. Community youth mobilization is based on community work in line with HIV. We realize that drug abuse is one of the causes of HIV, so we have joined hands with this NGO to work together so that as they sensitize people on HIV, we also sensitize them on the effects of abusing drugs.
My name is Mtinta Chihidi. I'm here, I'm invited by CYM. I'm coming from DHMT, Kabwe DHMT. We've been working with CYM in these programs, and I'm here to offer information on family planning services. The clients in the community, rural community, have got questions on family planning, on the commodities offered, side effects, and how they can access the family planning. And I'm here to talk to the community on family planning services that are available in the country, where they can find the services. There are services which are provided at the facility and services which can be offered at the hospital, like the Loop and the Jadeo, which is available.
Also, due to the absence of voluntary counseling and testing services in rural areas, CYM conducts mobile VCT in conjunction with partner organizations such as the Ministry of Health and other NGOs. At this mobile VCT in Hamdudu, people from different sections of the society are happy with the service and come to test. Even the blind are not left behind.
So in CYM, we value VCT very much, and that is why we try to ensure that the communities get access to it. Actually, what we do is we organize VCT days, such as the one you are just from seeing here, and they are actually very beneficial for the community because we actually give the community members a starting point to positive living, because they're able to know their status. VCT services are not available in rural communities, and so that is the more reason why we organize such days as this one, like the one you're just from seeing, and we provide the services to the communities. Actually, the good part about it is that we are happy that the community members turned out in numbers, and just today we've managed to test about over 60 people just about now. So it's a very good activity that we feel should be encouraged in more communities, especially rural communities where you cannot find these services.
The Community HIV and AIDS Intervention Program also conducts advocacy activities. The advocacy activities are aimed at finding workable solutions to critical HIV and AIDS issues affecting the rural communities. Issue-based workshops are organized to targeted community groups to discuss different issues affecting them. At the end of the workshops, an action plan is put in place by community members themselves, which CYM takes up to ensure it is implemented. What do community members say about all this?
We have changed even the attitude towards people who are HIV positive or those people who are suspected. Yeah, we have really changed. We have understood that AIDS is like any other disease, and somebody should accept it just like malaria. Yes. And it has even helped us to cancel those people who are not even able to come. You know, the elders might shun, they like to shun this place. But when they come, we tell them to say, don't shun that place. It is just like any other, like a clinic and so on. So that has improved very much to myself. I look at a person, well, I had some stigma sometimes. But after this program, I have realized that stigma kills people.
Yes.
It kills people.